Hello everyone, today we are going to learn about Tracheo-esophageal fistula, which is one congenital disorder of gastrointestinal system in child health nursing. So let's start with this introduction. So in introduction it is saying that tracheo-esophageal fistula and esophageal atresia are the malformation of digestive system in which esophagus doesn't develop properly, and esophagus is a tube that normally carries food from the mouth to the stomach. So in this condition the organ which will be mainly affected is your trachea and esophagus. Okay, so in this disease condition, the esophagus, which normally carries food from the mouth to the stomach, it will not develop properly, or there will be a malformation in the esophagus tube. So in this disease we are going to see two kind of condition will be there. First one is esophageal atresia, and your second one is esophageal fistula. So let's understand what is the meaning of atresia. Now the atresia, the meaning of atresia is if the esophagus it will not develop properly, or if the esophagus it will be not connected with each other. Now in this picture you can see the proximal part of the esophagus, it is not connected with the distal part of the esophagus. Okay, so there is a gap in between this esophagus tube, right? So this condition is called as atresia. Now the next condition is fistula. The meaning of fistula is it is an abnormal connection between the trachea and the esophagus. If there will be a connection, abnormal connection will be there in between the esophagus and the trachea tube, that condition is called as your fistula. Next is your pathophysiology. In pathophysiology, we are going to discuss how this TEF it is forming inside the baby's digestive system. So the upper part of the esophagus it develops from the retropharyngeal segment, while the lower half will be formed from the gastric segment, and during the 4th week of gestational age one laryngo-tracheal groove it will form, which is responsible to divide the foregut into two longitudinal tubes, which is further divide into two tubes, that is your trachea and esophagus. So in between that time, if there will be a defective separation will be there, or due to some condition if that two tubes it cannot be formed, in that time that it will lead to develop TEF inside the baby's digestive system. Now in this slide you can see how the esophagus and the trachea it is forming, right? How the foregut it is divided into two different tubes, that is your esophagus, and another one is your trachea. Next, so there are some types of TEF. One by one we will be discuss what are the types of TEF. Okay, so in type 1 you can see there is no connection in between the esophagus tube. Okay, so because there is no connection in between the esophagus tube, they will form two different blind pouch. Okay, so in type 1 there will be no connection in between the esophagus tube. Okay, so next we will see the type 2. In the type 2 what is happening, the proximal segment of the esophagus it is abnormally connected with the trachea, okay, which is called as fistula, and the distal part of the esophagus it is blind. Okay, so this condition have both fistula as well as your atresia. Next is type 3. In type 3, you can see the distal end of the esophagus, it is abnormally connected with the trachea, while the proximal part of the esophagus, it is blind. In type 4, you can see both the esophagus, it is not developed properly, and the proximal as well as your distal end of the esophagus, it is abnormally connected with the trachea. Now the type 5th, type V, it is also called as H type of Tracheo-esophageal fistula, where the esophagus, it is abnormally connected with the trachea, though it is formed properly. So what are the clinical features which will be pointed to the child if the child is having TEF within them? Okay, so there will be sign and symptoms of severe choking, and the fluid will be returned from the nose and mouth, and cases of cyanosis will be seen inside the baby's body if the baby will have TEF. Okay, there will be excessive secretion of saliva will be there, and cases of abdominal distension will be there, and cases of laryngospasm will be there, and accumulation of saliva will be there, and cases of pneumonia also will be there in severe cases. So what all are the diagnostic evaluation, and how we are going to diagnose the baby if the baby is having TEF? First, it can be diagnosed during the time of antenatal period through the ultrasound, and through the X-ray also it will show that esophagus, it will be filled with air. And next is, if the baby is having TEF, then the nurse, she will attempt to insert one NG tube through the nose to the stomach. But in TF case, that NG tube, it will not go inside the stomach. So that condition also, it will indicate if the baby is having TEF. Next is your management. So this tracheoesophageal fistula can be corrected by surgery, and in this surgery the surgeon, either they will connect that both blind pouch of the esophagus, or they will be going to remove that fistula from the esophagus, or they will be close that fistula depending upon the severity of the disease condition. So in this next slide, you can see where the esophagus, it is rejoined, and where the fistula, it is getting removed from the esophagus. So this was all about TEF. I hope you all understood, and if you have any doubt, you can ask me. Thank you.